Do something to end TB in Kenya.
Tuberculosis is an infectious disease that is spread through the air, caused by germs. And when a person has the disease and he coughs, sneezes or talks, he puts the germs in the air, and another person might breathe them in and then become infected with the disease. It is the fourth largest cause of death in Kenya, and therefore control of tuberculosis is a key priority for the Ministry of Health.
A persistent cough lasting more than 2 weeks, chest pains, weakness, loss of weight and appetite, fever, night sweats are some of the main symptoms of TB. However, we have extrapulmonary TB that affects all other parts of the body except the hair and nails. 1 in every 3 people has TB bacteria in the body, also known as latent TB, meaning that they are infected but have not fallen ill.
The Global Stop TB Partnership was started in about 2000 or thereabout. And it was to respond really to the growing burden of TB globally, and the need to have partners and people working together to advance TB, which had just been declared a few years earlier as a global health emergency. In Kenya, about 60 people are dying of TB every day, maybe more, which is basically like a bus crashing every single day. And so these are silent deaths that are happening in the villages and what have you that are not being recognized. So it is a major public health threat.
Sasa ndio nikuja kugundua niko na TB, nilishindwa kukula. Sahani moja ya chakula siwezi maliza. Nikikunywa maji natapika. Sasa ndio nilienda hosi. Nikaambiwa niko na TB, kaandikiwa shindano. Sasa nimeenda shindano, nimemaliza. Sasa naendelea na madawa. Na kunyonga dawa ya 3 kwa siku mpaka ziishe miezi 8.
TB is even more serious when it affects children below 14 years. Besides stigma, the children are faced with challenges from diagnosis to treatment. Close to 10% of all TB cases in Kenya are found among children below 14 years.
Kama akona kitu 6 months nikaona akona shida ya kifua, anatibiwa na mrudisha hospitali kwa sababu homa ishi. Penye walimpiga picha wakaona akona TB. Wakaniuliza kama anaweza chukuanga dawa huko kwao ama kliniki yenye iko karibu na mimi. Sasa kliniki yenye ilikuwa karibu na mimi ni Kangemi. Akaenda kimprove mpaka venye alimaliza hizo dawa. Zilikuwa tembe za kumeza, nampatia once jioni, nampatia na maziwa anakunywa. Last year nikaona tena ameanza kuwa weak. Kama ni kukula hataki, alafu sasa mwili yake inaendelea tu kudhoofika. Ndio nikamrudisha tena Kangemi. Wakaniangalilia wakaniambia apewe dawa tena kwa sababu ni kama imerudi tena. Wamempatia dawa za kumeza, amezimeza kwa 6 months akamaliza.
Mimi niko sawa. Mama alinipeleka hosi, nafurahi kucheza na watoto wengine, naenda shule.
Kenya, we are not doing very well in TB control because at the global level we are ranked 15th out of the 22 high burden countries. Those are the 22 countries in the world that contribute 80% of the total TB burden in the world. At the regional level, that is in Africa, we are rated number 4. That is after South Africa leading the pack, followed by Nigeria. Ethiopia comes 3rd, and Kenya comes 4th. So basically we can see we are not really doing well, and we need to put all the efforts we can to make sure that in the next few years we come out of this, I call it list of shame of TB countries.
TB poses serious challenges to the country's health system and the socio-economic well-being of the nation. Majority of TB patients are aged between 15 and 55 years, representing the most productive segment of the population. Reports indicate that the country loses about 11 billion Kenya shillings to the disease each year.
When you are sick of tuberculosis, you are not able to go to do your work, you are not able to fend for your family. Therefore, you lose a considerable amount of time spent as you are either in bed or feeling unwell. That is before the diagnosis. Secondly is that when you start the treatment, in the first initial days, you are still a bit unwell and you are not able to continue with your activity. So there's that loss of income from the activities that you would generally be doing. But also in terms of cost, there is a cost that the country incurs in terms of providing the drugs, providing the treatment and the testing or the screening facilities. This is a cost. But also to the individual, there is another cost, a psychological cost in terms of the stigma that is brought to the society. So, and the strain of the health resources that are available. So if you have a certain number of economically productive people unwell, then they are not able to do their work. So TB is both a health and a socio-economic issue in that regard.
The war on TB has been complicated by the emergence of a strain of the TB bacteria that is resistant to TB drugs. This strain is far more lethal than the common form of the disease.
Sikuwa najua nina TB actually, nilianza na kama homa, cough. Sikuwa hata na cough sana, ilikuwa dry cough. Kuumwa na kifua kiasi. So I thought nina homa, nikaenda Bagathi Hospital. Then in that period nikadiscover niko na mimba ya kido 3 weeks hivyo. So nilipata TB at the same time niko na mimba. Nikaambiwa nitoe kohozi, ipimwe pia. Ikakuja ikawa 2 positive. Wakanituma Kangemi Health Center nianze dawa za TB. After taking medicine for 2 months nikapimwa kohozi tena ikarudi kwa 3 positive. That means hata nika TB imeongezeka badala ya reduce. Akasema nitoe kikohozi nipeleke culture Kimri. Ikakuwa niko na 2 positive na niko 2 resistant, resistant to drugs. So nikakuwa na multi drug resistant TB. Shida ilikuwa singeanza hizo dawa juu nilikuwa na mimba, sana au mimba ilikuwa kido 5 months 6 months hapo. When I went to Kenyatta, dukia kaniambia is either ni terminate mimba ama ni goje mpaka nipate mtoto. You're already now 6 months pregnant, nipate mtoi, hivyo nianza na dawa za MDR. I used to take 18 tablets and 1 injection per day for 2 years. Okay, injection went for 1 year, those are 12 months, and tablets zikaenda for 2 years, those are 24 months. After nimepata wamejua niko na MDR, wakatuma barua kwa shule. So I couldn't go back to school. After 2 years, when through medication 2 years, then you go back to school. Those are 5 years already on my waist.
We have been able to successfully treat close to 1,500 Kenyans with drug-resistant tuberculosis, which takes long and is more expensive to treat.
Everyone has a role to play in making Kenya a TB-free country in homes, offices, factories, markets, places of worship, schools, prisons, colleges, recreational facilities, matatus, airports, and even health facilities such as clinics and hospitals.
Why we need to focus on TB is because TB is treatable, TB is preventable, and TB is curable. There's something we can do about TB. We just need to have the right information, we just need to invest in the right approaches, we just need to engage the right people, and we can eradicate TB.
Sasa wakati nilikunywa madawa, nikasikia niko na nguvu, nikaachana nazo. Kuachana nazo ndio ikanirudia tena. Nikaenda hosi nikaanza madawa tena. Sasa saa hii najikakamua nimalize.
As Kenya continues to combat TB, only about 6 billion shillings of the estimated 26 billion required to eliminate the disease is available at national and county levels.
There is something which touched me most about a year ago plus. At that particular point is that the TB patient were put at a very big risk because of lapse of drugs, and we picked up an issue which was very delicate, and you can imagine as a country we ended up borrowing TB drugs from Malawi. At that particular time I raised the issue with the Committee on Health and the ministry itself, and the government pulled very fast on supplementary budget and allocated money to buy drugs, allocated money to get some test kits, and also the donor community realized the urgency which was in Kenya. My happiness will not to be re-elected as a member of parliament, but my happiness is to wake up one day and say that we have a free TB Kenya.
Everyone has a role, depending of course on what you do. We are not asking people to go out of what they usually do, even within the confines of what you are already doing, because that's what you do. You can find space there to contribute to the fight against TB. And the Stop TB partnership will just basically be showing you the role you can play in the area that you are already in.
We have to look for TB where it is, and that is in the communities, in the offices, in the churches, where we live. You know, the difference the Stop TB partnership is out to look to bring is looking for those sectors that have not been engaged, especially the private sector.
Let us unite to make Kenya TB free.
Today we launched the Stop TB campaign. Do something.
Do more.
Do better
Together.